this piece of work, which was actually looking at the change over time in 10 years of utilising the two-way wake pathway. What we found was even before NICE, referrals were going up 10% year on year. So we started off just under 1 million referrals in 2009-10, and in the last year we looked at 2018-19, 10 years later, it had gone up to over 2.2 million. So that's a sort of more than doubling, 10% year on year increase. And actually also over that 10 years, we found a real significant improvement in how many cancers picked up by the pathway. So that's gone from 41% cancer detections, that's gone up to 52%. It's a testament to primary care, GPs and secondary care to manage that, and actually keeping most people, 80-85% of people seen within 2 weeks is actually amazing. We certainly need a more nuanced approach, looking at different pathways and cost effectiveness of the gold standard tests. People might be aware of the Rapid Diagnostic Centres, and there's been some papers published in BJGP about that. So that's kind of being rolled out across the country. And I think we need to be both aware of that as GPs, that actually that really is a route to access CT scanning. Other countries like Australia don't need RDCs because the GPs can access CT scanning and gold standard testing. So actually this is a route in that we can start utilising if we're worried about a patient, not quite sure which pathway, but I've got this gut feeling, and we know gut feeling has a strong predictive value from other research from Brian Nicholson and colleagues. Actually, if you've got a gut feeling, you're not quite sure what's going on, maybe weight loss, vague symptoms, utilise these RDCs. The predictive value of our referral. So I actually tell that to patients, say, what, in terms of I'm referring you, what chance of cancer do you have? Previously, it was 1 in 10. So that's dropped to less than 7%. So I do use that in my clinical practice, say, look, there's enough risk there we do refer, but patients don't necessarily feel worried. The majority won't have cancer. The good news story is we now are back up to pre-pandemic referral levels. So testament to everyone, hard work, whether that be online, face-to-face, we're getting bashed in the press, but actually we're offering more appointments, more routes than ever before. So I think actually this is a positive narrative, thanks to everyone who's been working so hard.